All right, welcome back and thank you for staying with us. We'll be diving right into our discussion segment. And yesterday, the world marked World Humanitarian Day 2025, a day to honor aid workers who risk everything to save lives and to reflect on the struggles of millions who depend on humanitarian assistance. Now, behind the numbers are heartbreaking human realities. Imagine a mother in Borno State who has to watch her child waste away because there's no food in the camp. Picture a father in Zamfara who goes to bed hungry so his children can eat, or the aid worker in the northeast who puts himself in danger daily delivering relief to communities caught in conflict. These are the faces of Nigeria's humanitarian crisis. Now, the United Nations warns that 31 million Nigerians are food insecure. That means entire households unsure of where their next meal will come from. More than 10 million children under 5 are acutely malnourished and 3.5 million are in severe conditions. Even more alarming, about 400,000 children could lose their lives if nothing urgent is done. Yet, this crisis is unfolding at a time when global humanitarian funding is shrinking, leaving those most in need with even less hope. Food pipelines are drying up, lifelines for children are breaking, and the burden falls harder on communities already struggling with poverty and insecurity. Now, this year's theme, strengthening global solidarity and empowering local communities, cannot be more urgent. The question is, how do we move beyond aid dependency to solutions that restore dignity, build resilience, and ensure that no child dies simply because they were born in the wrong place at the wrong time? To help us explore these issues, we're joined by Benson Agbro, Director of Disaster Management at the Nigerian Red Cross Society. With over 20 years of experience in disaster preparedness and humanitarian response across Africa and beyond, he will help us understand the human cost of this crisis and the potential pathways forward. You're highly welcome and thank you for joining us this morning.
Welcome. Thank you for having me.
All right, let's dive right into it. The question I would like to ask is, what do you think the human costs are borne by the front line, of the humanitarian workers, and how do these costs influence the sustainability of humanitarian interventions? We understand that we're getting drawback when it comes to international interventions. What is being done to make sure that these interventions don't cut short and a lot of people do not suffer due to that?
Thank you very much for that question. I think we should look at how we can have homegrown solutions, nature-based solution. We should be able to take care of our own. We have been dependent on what I call imported aid for a very long time. And it is high time now that the global funding is shrinking greatly, that we look at what we can do within the borders of our countries, various countries in Africa, and come up with enough resources. We do have resources in Nigeria, for instance. We should be able to raise resources that are enough to take care of our own. Disasters happen everywhere. Nigeria is no exception. It is the ability of the various nations, the various countries, to be able to take care of their own that really matters.
All right. When we look at it at this particular moment, we have a lot of displacement in Nigeria when it comes to insecurity, when it comes to disaster as well. And as we mentioned, that these resources are dwindling when it comes to, international funding. What in particular at this particular moment is the Nigerian government doing to make sure that steps are being taken so that the displaced are not that much in dire desperation, as well as, helping, the humanitarian workers, because they're at the forefront of that, helping humanitarian workers in making sure that their job is done easily and safely?
Well, like I said, we need a lot of resources for this, and we are aware that the Federal Ministry of Humanitarian Affairs and Poverty Reduction are working hard to coordinate humanitarian operations in Nigeria. We're also aware that the government has, of recent, released some amount to the National Emergency Management Agency, NEMA, to be able to take care of those who are suffering as a result of one incident or the other. But the government cannot do it alone. We need a situation where the private sectors will also come in to aid people who are at the forefront, who are taking care of fellow Nigerians who are in distress, like you said, as a result of one form of incident or the other. This could be man-made or they are natural in nature. But the truth is that they are Nigerians like us, and we need to do our best to be able to take care of them.
So yesterday, the world marked World Humanitarian Day, and the Red Cross is also on the front line when it comes to providing aid to people in distress and during conflict. In your view, what are the biggest humanitarian challenges Nigeria is facing today?
Thank you. I mean, there are so many. There are so many, and we in the Nigerian Red Cross are doing our bit, and I guess other agencies, both government and non-government organizations, are also doing their bit. The costs are high. I recall some years back in 2017, we actually lost 7 of our volunteers who were helping people out in Borno. Friendly fire, they call it. It was a mistake which was accepted by the body that did the bombardment. But we lost 7 people, and 7 others were injured. Of recent in Kwara, our team were going out for cash transfer programming, and they had an accident. We had like 8 people, actually 9, who were hospitalized for a long time. 5 of them went through surgery. This is just human, the cost of humanitarian work. Not to talk of the funding involved. Globally, I think in 2023, I understand more than $51 million went into humanitarian work. We can't quantify what we have used in Nigeria, from the government, from the international partners, and the local NGO working together. So a lot is going on to try and resolve some of the outputs of the crisis and natural disasters that we have in Nigeria. You can name them. You already mentioned security incidents. We have the flood. We have the drought. We have so many incidents in Nigeria. It could just be fire. Of recent, you heard about Mokwa crisis. As I speak, our team is still in Mokwa. Affected. The government was there distributing food items and cash to them also. So these are some of the humanitarian problems we have in Nigeria.
All right. We know that safety is very important. As one of the outfits that are involved in delivering humanitarian aid, how do you make sure that your humanitarian, should I say, workers or volunteers are safe enough when it comes to doing their job?
Well, we take all the precautions necessary. We have our standard. We do a lot of engagement with the community engagement and accountability. We don't go into any community without having access. And we build our access over the years. You will have noticed that when the Red Cross goes out, we don't go with security personnel. Our security is the relationship we have with the people on ground. And that is what has kept the Red Cross globally going for a very long time. There's the confidence that the people have in the Red Cross that probably don't have for some other places. Where others can't go, we go, because over the years we have been there for different incidents. We have been working even at peacetime with these communities. I think that is the major thing that we have that under us. And then we have a good spread. We have over 800,000 volunteers all over this country. We are present in all the states and most of the local government areas. Wherever there is a problem, the Red Cross is there. We don't want problems, but disasters do happen. And when they do, there should be people on ground to offer succor to those who are affected.
So with Nigeria facing floods, conflicts and health emergencies, how does the Red Cross prioritize where to act first? Thank
you very much. The Red Cross, maybe I should just explain briefly the structure of the Red Cross. Globally, we have 3 arms of the Red Cross. We have the International Committee of the Red Cross, which is like the father of the Red Cross. We have the International Federation of the Red Cross and Red Crescent Society, which you might call the mother. They're actually the secretariat of the Red Cross. And then you have the national society like Nigerian Red Cross, Ghanaian Red Cross, British Red Cross, Iraqi Red Crescent, Bangladesh Red Crescent, and so on. Now, when it has to do with crisis, violence, the ICRT, International Committee of the Red Cross, plays a very vital role because that is the area of specialty. When it is natural disasters, the International Federation of the Red Cross and Red Crescent Societies plays a vital role. But in all this, in country, it is the national society of that country that actually implement most of these activities. So you see a situation where either the ICRC or the IFRC is supporting the national society like Nigeria Red Cross to act. And we don't wait for disasters before we act. We prepare a lot. The full cycle of disaster management is what we work on. So before there is a crisis, we already built up our emergency first aid teams. These are semi-specialist volunteers who are trained in various thematic areas. For instance, they teach some of them search and rescue, up to first aid, just name it, psychosocial support, shelter, water and sanitation, so that they are able to reconstruct houses or do temporary shelter for those who are displaced, like we are doing in Mokwa right now. And it is even as high as training some of them on how to manage human remains. So, because they do happen. I mean, if we have a lot of people who are on ground, we would like to ferry them either as pre-hospital care to the hospital or help the authorities to manage the dead bodies. We do that.
All right. So when you talk about the numbers, when it comes to casualties, when it comes to, insecurity or a natural disaster, as well as other aspects when it comes to health intervention, what does it look like in those situations, in those areas, due to the fact that a lot of people do not understand the severity of it? How can you elaborate so that people can understand the intensity of what is going on?
Well, I'm sure the people know. I mean, if your family member is sick, you know is sick. If he's affected by one epidemic or the other, you know, and take such people to medical facilities. But what we are looking at is a situation of sudden onslaught of one form of disaster or the other. I mean, flood just coming up and washing a whole community away. They never expect this. What we preach is that each community should be able to have some certain people trained in some thematics. It could just be divers, local divers, who should be able to rescue those who are in flooded water or when there's a boat mishap. It could just be a quasi team that work on first aid, that are trained in first aid, or that they are trained as community health workers to be able to help out during epidemics.
All right. So with this day that has been celebrated, how does, honoring humanitarian workers on World Humanitarian Day obscure, or should I say reveal, a deeper systematic risk they face?
Well, it is a day set aside by the United Nations since 2009 to at least appreciate those, like you said, our heroes past, those who lost their lives, or those who are injured, permanently injured or partially injured. And again, to thank humanitarians who are usually in the front line. at the risk of their life, saving others, helping out. But the humanitarians should also know that they are in danger of being injured or dead and take safety precautions. For us in the Nigerian Red Cross, we conduct a lot of training, awareness sessions for our volunteers based on security. And we don't just move. We have a very strong security unit. The Nigerian Red Cross, the International Red Cross who are here, Federation and ICRC, do not play with security. So before we undertake a mission, we usually will have sent our security team to check out the area. Like I said, we have a very good working relationship with all the communities in Nigeria, but we don't take security incident for granted. We make sure that we also check before we move.
So international funding is, should I say, gradually collapsed, have collapsed in total. But, the need for, international funding in Nigeria keeps rising on a daily. So in your own assessment, do you think Nigeria is prepared to take on more of the humanitarian burden locally?
The answer is neither here nor there. I mean, like I said earlier, a country should be able to take care of itself. But are we able? That is the big question. For us in the Nigerian Red Cross, we are looking inwards. We are collaborating with local actors to see. We do a lot of humanitarian diplomacy sessions now, where we invite the organized private sector, where we invite the government, the diplomatic corps, and everybody to sit at the table and look at how we go about doing this. The UN agents, the body, including all the World Health Organization, UNICEF, and all of them, even as the funding cut is affecting them, they are also interacting with all of us to see who can step in, even when they move away. So a lot of discussion is going on. We expect the Federal Ministry of Humanitarian Affairs and Poverty Reduction to take part of that coordination from those who are leaving and those whose funding is gradually going down, then replace that with internally sourced funding for these operations.
Okay. All right. So in this case, what role do you think data can on human cost and benefits play in shaping, humanitarian funding and a response to strategies globally and especially here in Nigeria?
Well, we need the data. We need all the information we can get to plan. Preparedness is key. I mean, and just special data, just name it. Technology has to come into play to be able to know what the magnitude of any of these disasters in case it occurs and plan for them. And when it has happened, we also know that we need technology, again, technology-inspired data to be able to accurately determine what help those who are affected need.
All right. So in your own view, what policies can be put in place to make sure that, humanitarian aid is on the right path when it comes to, mitigating the rate of the internally displaced people that we have, and aside from that, health aid as well as insecurity?
The government is doing their bit. There are agencies that, by legal status, are placed in charge of managing internally displaced persons, the IDPs. What they actually need, we had very good plans, strategic plans in place. For us, the Red Cross, there's none of these workshops that is organized to come up with such plans that were not there. Just yesterday, NEMA, working with an international partner, call us together once more to validate a preparedness plan, strategy for the country, 2025 to 2030. So we have these plans in place. Like you said, what we need is the actual funding to actualize what we have planned. You can have the best plans file, I mean, if they are not implemented, like the representative of the NEMA DG said yesterday, you have all the actors will need their buy-in to be able to implement the plans that we have collectively decided to do. Not just on preparedness alone, but on response and rebuilding better in the areas where disaster have struck.
All right. You just made mention of preparedness. So we know the Red Cross has decades of experience in disaster preparedness. What early warning or anticipatory action could Nigeria adopt to prevent, humanitarian crisis instead of only responding after they happen?
The focus should change from just response to more of preparedness. And I usually advocate for anticipatory action. You mentioned data just now. I mean, evidence-based, driven, anticipatory action. I give you an example. We worked with a partner not long ago, and we identified flood-prone communities in certain states. And working with our Red Cross Climate Center and NIMET here in Nigeria and some other hydromet agencies, we were able to accurately predict where the flood will hit. We went to this community, had discussions with their leaders, and when we do that, we constitute what we call CROC, Community Resilience Committees, which is made up of a good representative of the community, the rulership, the women leaders, the youth, persons living with disability, and so on. They are part of that CRC. And then what did we do? We provided resources for them to be able to move away from the flood path. So when the flood came, we had less dead or no dead in many of these communities. And people, it is cost effective to do that than to wait for the flood to wash such a community and then we begin to run helter-skelter, providing food and non-food items.
So in your view, do you think we have enough youth in Nigeria engaging in humanitarian service?
I think there are challenges. I mean, the youth need to be a little comfortable for them to volunteer. When youths are struggling to survive, it is hard for you to recruit them into volunteerism.
So how can we inspire the youth to go into humanitarian service?
National Orientation Agency is doing a bit on that. We have met with them severally. I think we need reorientation of the values of the society and encourage our youth. For us in the Red Cross, we want to catch them young. We go to schools, we have school units, we have open detachment. The school units operate within, the Red Cross unit operate within the Red Cross, the school, and the open detachment are open to those who are outside the school that want to join. Just a few days ago, someone approached me from a private nursing school in town here. They want to set up a Red Cross unit. I think that is the way to go.
All right. So this year's theme calls for empowering local communities. What are some of the practical ways communities themselves are already responding to hunger and crisis, and how can those efforts be scaled up?
Communities need to be organized into community response teams. And the Red Cross have been doing this for some time now. Working with the British Red Cross, we are working in 5 states, identified 5 states: Lagos, Imo, Delta, FCT, and Bauchi. And we identify local governments that are prone to flood. We're working with these communities. We have done a lot of capacity building for the community volunteers. We set up community response team, train them to be able to help themselves in case of disasters. I think more communities need to buy into this, more agencies, not just leave it for the Red Cross. More agencies need to come, do similar things. They might not call it community response team, but something like that, that can empower the community to help themselves. Because sometimes, even before the first responders get to a certain area in the community, the worst could have happened. But if the community have their own response team, or first aid teams, or community, whatever they call it, that are able And this could be made of young men and women who are agile and able to respond.
So if you had the ears of both the government and the international donors today, what 3 urgent steps would you ask them to take immediately to save lives?
I would tell them that we do know that other parts of the world have crises, and they should not keep shifting resources from areas they think that need less. We need more. It might not make headlines as it used to be, but we do know that these crises are there. We do know that natural disasters will happen. We do know that every year we have flood problems in Nigeria. So we should plan for them and make sure we save the lives of our people, whether they are international partners or the government at the central level, the local level, the states should all plan. At the national level, I already mentioned NEMA. At the state level, we have the state emergency management agencies. And at the local government level, we have the local emergency management committees. This local emergency management committee needs to be active, just like the NEMA is active at the federal level. I mean, disaster management is local. If we have all the local government management committee, emergency management committee active, I'm very sure that SEMA and NEMA will have less work to do.
Okay. All right. Now, how do we balance immediate relief with, long-term development so that Nigerians are not just fed today, but also, able to stand on their own tomorrow?
Well, some of the state governments are already looking at that. They usually tell you, don't come and make distribution. We want you to build the capacity of people to take care of themselves. And that is why Nigerian Red Cross, working with partners, are also looking strongly at livelihood as a disaster management tool. So what we do now is to look at those whose businesses are affected, provide some amount for them to reactivate their business in such a way that even when flood or any disaster come, they are able to withstand it because they have the resources to do what they want to do.
All right.
But our resources are limited. As a Red Cross. We are not government, so we just do the bit we can.
So when it comes to, providing intervention, taking resources to those communities that have been affected, you would see sometimes you get a lot of discrepancies when it comes to the distribution of those, intervention items. So how do you make sure that those items the intervention goes to those people that actually need it?
First of all, you get the community involved. Don't just go to the market and buy what you think they need. So we do a lot of assessment the Red Cross way, using our normal Kobo collect that is simple for our volunteers to use. So from that assessment, we determine the needs of the community. And then we try as much as for us, let's take food assistance for instance. When we procure food, and we have very strict procurement procedure, and then we have standard operational procedures for these community actions. And what we do is that the vendors take this food directly to the community. So even myself, who is the director, do not see the food. You, who is the branch secretary at the state, may not see the food. You will see the food at the distribution point. Now, before the food comes, after the assessment, we conduct registration exercise based on set criteria. Let's take flood, for instance. Were you affected by the flood? Was your farmland affected? Did your shelter get damaged? Is it partially damaged or fully damaged? We have all those statistics. So if it is food that we are distributing, we have a ticket that we already got maybe some weeks back, and now we are here. So you present the ticket, they check it, cross-check it on the computer to be sure that it's your picture that is there. They clear you, you take that tally to the next stage. So there are points you should follow till you get your food. And as you get your food, you move out so that people don't come begging or trying to get your food. If it is cash, we do a lot of our distribution cash now because that gives a leeway for the recipient to buy whatever they want, unlike when you just give specific items. And we work with, I won't call the names of the bank, we work with financial service providers. What we do now is to get prepaid cards. In fact, in the prepaid card, the name of the recipient is on each of these prepaid cards. So you can't even, and then what we share is not cash. We give that card and we give you the code. You can change the password.
Just like, your ATM cards. Okay.
But the only difference is that you might not be able to use the ATM again because you don't have an account per se.
Okay.
So if we say...
as soon as the funds are finished from the account...
you can withdraw as many times as you want. Okay. But that is what we give. So it depends. In some cases, we give 100,000, 80,000, 150. If his livelihood is above 300,000, so on.
All right.
And this is based on donor that gives.
Amazing.
All right. Thank you very much, Mr. Benson Agbro, Director of Disaster Management at the Nigerian Red Cross Society. Thank you so much for being here.
Thank you for coming.
It's my pleasure. And thank you, Daily Trust, and thank you, Trust TV, for the work.
All right. Thank you so much. All right, with that, we've come to the end of the discussion segment. We'll be going on a quick break. When we come back, we'll be looking at our front pages of our national dailies. So stay with us. We'll be right back.